Hi everyone, welcome back to my YouTube channel, and today we are going to talk about maxilla. Here at the side you can see the diagrammatic representation of skull, and the green highlighted part is showing the bone that is maxilla. So let's start our topic with introduction. Maxilla is pivotal bone in human craniofacial skeleton, serving as both foundational component of facial aesthetic and a key player in several critical functions. As the upper jawbone, it only houses the upper set of teeth but also forms a major parts of orbit, nasal cavity, and palate. Now let's talk about structure of maxilla. Maxilla is an irregularly shaped pear bone that forms the central portion of mid-face. It plays a crucial role in shaping the facial profile by contributing to the structure of cheeks, nose, and upper jaw. The bone is composed of several processes and regions that integrate seamlessly with neighboring bones such as zygomatic bone, nasal bone, lacrimal bone, and palatine bone. Now let's talk about key features of maxilla. The first key feature is alveolar process. This is the portion of maxilla that forms the upper dental arch. It directly supports the root of the maxillary teeth, providing stability and contributing to the proper occlusion. The health of alveolar process is essential for both dental function and overall facial aesthetic. Now let's talk about palatine process of maxilla. It extends medially. The palatine process forms the anterior section of the hard palate. This bone is partition is critical as it separates the oral cavity from the nasal passages, aiding in speech, swelling, and protecting the airway. Further talking about key feature, it has zygomatic process, that is the process project laterally from the maxilla and articulates with the zygomatic bone. This process contributes to the formation of prominent cheek and offers structural support to the orbit. And next it has a nasal process, that is the process extends upward to contribute to the formation of lateral wall of nasal cavity, thus playing a role in both the separation and overall contours of the face. Further talking about key feature, it has maxillary sinus that is present deep within the body of maxilla, lie the maxillary sinus that is the largest of paranasal sinuses. The air-filled cavity helps reduce the overall weight of skull, contribute to the voice resonance, and serve as a buffering during facial trauma. Now let's talk about the developmental aspects of the maxilla. First, we will talk about its embryological origin. Maxilla developed through intramembranous ossification from neural crest derivative derived mesenchyme, bypassing a cartilage precursor stage. This process began early in prenatal life and is crucial for establishing the framework of the mid-phase. As the maxilla ossifies, several ossification cells emerge to form a coherent structure that will support the developing dental and palatal component. Further talk about development aspects, we will talk about growth and maturation of maxilla. Throughout childhood and adolescence, the maxilla undergoes significant remodeling to accommodate facial growth and dental eruption. Factors such as genetic influence, functional forces from mastication, and environmental variables all contribute to its maturation. Proper growth of maxilla is essential. Any disruption during this phase may lead to malocclusion or craniofacial anomalies such as cleft palate or midfacial hypoplasia. Now let's talk about functional significance of maxilla. First is dental support and mastication. Alveolar process of maxilla is directly responsible for anchoring the upper teeth, making it integral to effective mastication. The proper alignment and integrity of dental arch are critical for achieving speaking and maintaining overall health. Further talking about functional significance, there is formation of the facial skeleton. As the maxilla broad contribution extends to the shaping of the midface, it forms a significant portion of orbit, medial nasal apparatus, and hard palate. In doing so, the maxilla not only influence facial aesthetic but also ensure the vital functions such as vision, respiration, and phonition as preserved through its structural support. Further talking about its functional significance, it is also involved in respiratory function. Though its role in forming the hard palate and lateral wall of nasal cavity, the maxilla helps airflow between the oral and nasal cavities. This function is particularly important for speech articulation, maintaining appropriate airway pressure during breathing, and filtering inhaled air. Now let's talk about clinical significance of maxilla. The first is fractures and trauma. Owing to its prominent location and extensive articulation with adjacent bone, the maxilla is vulnerable to traumatic injuries. Fracture, whether resulting from direct impact or as a part of more complex midfacial injuries, can lead to dental misalignment, sinus complication, and even compromise the airway. Accurate diagnosis using imaging techniques such as CT scan is crucial for effective surgical intervention. Further talking about clinical significance, there is dental and orthodontic implications related to maxilla. Dental health is intimately linked to the integrity of the maxilla, as conditions such as periodontal disease, tooth loss, and congenital malformities like cleft palate necessitate a detailed understanding of maxillary anatomy for successful treatment. Orthodontic intervention often rely on repositioning or accommodation of maxilla to correct malocclusion and improve facial balance. Further talking about clinical significance, there is maxillary sinus condition that may affect maxilla. The maxillary sinus due to proximity to the central roots are frequently implicated in odontogenic infection and sinusitis. Infection within the air-filled spaces can result in chronic sinusitis and may propagate to adjacent craniofacial structures if left untreated. Advanced imaging and prompt management are essential in these cases. Further talking about clinical significance, there is reconstructive and cosmetic surgeries that may influence maxilla or that may be associated with maxilla, as surgical reconstruction of maxilla following trauma, tumor resection, or congenital deformity present complex challenges. Surgeons must restore both function and aesthetic, often utilizing bone grafts and implants to establish the maxillary contour and support structure. Innovation in reconstructive techniques continue to enhance outcome for patients with maxillofacial defects. Now let's talk about conclusion of this lecture video. The maxilla is the central element and architecture of human face. Its multifaceted roles from supporting dental function and shaping facial contours to forming integral parts of orbit and nasal cavity underscore its importance in both health and disease. A comprehensive understanding of maxilla anatomy, development, and functional significance is essential for dental, medical, and surgical professionals. Advancement in imaging and reconstructive technologies provide exciting opportunities for further research into maxillary biology and importance of treatment strategies for midfacial disorders. And this was all about maxilla. Hopefully you liked the video. If you do, don't forget to like, share, subscribe, and comment. Thank you for watching.